Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, we head to Lincoln, Nebraska to speak to Lincoln's mayor, Lyrian Gaylor-Baird. We talk about what it has been like to lead her city through the immense challenge of the COVID pandemic. It's a great conversation. Let's listen. Mayor Lyrian Gaylor-Baird, thank you so much for joining me on Public Health on Call. How are you doing today?
I'm doing well, and it is a real honor and privilege to be on your podcast. Thank you so much, Josh.
So I want to start by giving you the opportunity to introduce yourself to our listeners. Tell us about Lincoln, Nebraska.
Lincoln, Nebraska is the capital city and home of our flagship university. It is a wonderful city to raise a family, and we think it's the quality of life capital of the country. We're known for our Huskers, our football, and our volleyball team just played in the national championship. And we have great public schools and wonderful trail system. And we are a great place to live. And I'm really proud to serve as the 52nd mayor of this community.
And how many people live in Lincoln?
We're just edging up on 300,000 people in our community.
And how long have you been mayor?
I was sworn in May of 2019, so just over 2 years.
And tell us a little bit about your background.
I am the daughter of two public school teachers, and I have spent my career working in private and public and nonprofit sectors. I have worked in management consulting, working with Fortune 500 companies, helping them be more efficient. I sort of spent a fair number of time working on trying to help young people from low-income communities get on a path to college, working with the Boys and Girls Clubs, directing a Boys and Girls Club, and have spent some time in City Hall working on budgets before eventually serving on the Planning Commission here in Lincoln, followed by serving on the City Council, and then most recently mayor.
That is an incredible background for this job, but I'm guessing in May 2019, is that when you said you became the mayor?
Yes.
That you did not run on a pandemic preparedness platform.
No, I did not. It's sort of funny. I remember when I was running for mayor, we had a historic natural disaster, flooding, and what they called a bomb cyclone. And the previous mayor and his team were dealing with it all weekend, several days. And I remember thinking, what a prolonged emergency. Little did I know.
Yeah, now it seems like, right, the smallest blip ever. So, you don't get to choose what happens when you're mayor, I guess, and you have had to lead the city through this tremendous crisis. Tell us a bit about what that's been like.
It has been incredibly difficult for me, just like it's been incredibly difficult for everyone who calls Lincoln home. I think one thing I feel grateful for is that in the midst of this unprecedented crisis, I have felt a great sense of purpose, looking out for my community, lifting up the stories of strength and resilience in the community, being able to share that broadly and widely to provide some inspiration for those who are struggling. And then, of course, just to be working with this incredible city and county team. There are so many dedicated public servants, and it's been a real testament to local government here and all across the country, sort of the dedication, expertise, commitment, and creativity that has been on full display. I don't know that I would know what it would be like to be this proud of our city had it not been for this incredible challenge.
Now, you have a health department at the county level, is that right, that you work with? But you have had to take actions at the city level. So maybe talk a bit about the kinds of jobs that fall to the mayor in the pandemic. What did you have to do?
Well, we luckily work very closely. The health director is a direct report to the mayor, and we are very unified in our approach. I think that one of my main jobs has been to be a communicator in chief to help support the work of the health department and communicate that broadly and widely so there's more shared understanding of both the situation on the ground, the approaches being deployed to address the situation, and really calling citizens to action, calling our community members to a higher purpose as well. So it has been an incredible partnership, and not just with the health director, but with the entire city team to continue to provide city services. One of the things that we witnessed last year, of course, was many, many people staying home to keep people safe. But our city employees, our police, our fire, folks who take care of our streets, who work on our utilities, they couldn't stay home. The vast majority, almost 75% of city employees were reporting for work every day throughout the pandemic. And in fact, the folks who keep the water running to our taps, they rented campers and camped in rotating shifts at our water plant to make sure that we could provide continuity of our most essential natural resource to our community. So, from our office, it's really been about coordinating those efforts, making sure that we remove any barriers to their success, and instituting policies that help support the needs of a pandemic, whether it's a pandemic leave policy or whether it's additional partnerships to ensure that we have childcare provision and to, of course, make sure that the public knows what they need to do to stay safe and to protect the community.
How did you try to get the word out about those sorts of things? What are the mayoral tools that you had?
All the things. We did over 122 briefings in the year from the time that we started initiating those in 2020 through the end of 2021. We were doing daily briefings for months. This is for the press, but also for the public who tuned in. We had a pretty large following on our YouTube channel, social media, speeches, remote presentations, and really convening. I mean, one of the main jobs as mayor is to convene groups of people to share ideas and information in order to advance the success of the community. So there are a lot of virtual convenings to share information, to hear back from what the public needed, what their concerns were, and how best to respond. The other side of it, along with just the public health approach, was addressing the economic impacts. And we convened a mayor's economic recovery task force, business leaders, community members, small and large business owners, chamber representatives, who spent several months developing recommendations for how we try to address the economic impacts of this incredible public health emergency. And so in the wake of that, we've been working diligently to implement the recommendations, and it's been a big task, and we're really, really grateful to have some of those American Rescue Plan dollars to help make those recommendations into realities.
What about the losses that have been suffered by people in Lincoln, the key people in the community who died, the communities that were more heavily affected, the grief, the trauma? What has been your role in talking to people, helping people through this miserable period?
We've always tried to humanize the numbers that we've shared and to remind people that when we report out a handful of deaths on a particular day, that these are our fellow community members, they're friends and family, they're more than just numbers. And we've worked to try to help people understand that each one of us has power. People feel powerless. They have felt powerless at various points and to various degrees throughout the pandemic, but what they can do. But part of it is making a connection between the choices people make on a daily basis and the real lived experience of some of our most vulnerable community members. And to that end, we've of course had a big focus on protecting the most vulnerable. We worked really closely with our long-term care facilities to make sure that they were vaccinated early, that there were strong non-pharmaceutical interventions before we had vaccines. We worked with our cultural centers to try to address vaccine hesitancy in particular populations of our community. We've done clinics and vaccination clinics in targeted areas where we have lower vaccination rates. We've done so much to try to eliminate disparities in information and uptake of vaccine. And I'm really pleased with the progress our health team has made in partnership with community leaders. We couldn't do that on our own. This is a collective effort to save lives. And we've also, I think, lifted up people's voices and let people speak for themselves about their grief and their loss. We've brought in nurses and doctors. We've brought in the experiences of real people in our community who've suffered losses and tried to make sure that the full picture of this pandemic is understood and perceived by everyone in our community.
Along the way, you've had to take some controversial actions. If I'm not mistaken, for a very long time, you had a indoor mask mandate in Lincoln at a time when I'm not sure it existed in other places in Nebraska. What was your thinking in doing that, and how did it work?
Well, that's precisely right. We were the first community in Nebraska to implement a mask mandate, and it was a very difficult moment. We knew, our health team knew, public health experts across the country were making the latest information available, the developing understanding that masks had a strong role to play in slowing the spread of this airborne disease. And it was, really just at a time when we thought it was necessary. We were being told that if we did it, we might be sued by the state that strongly opposed implementing any sort of mandates. And I guess it was just a real test of doing what you believe is right, even when there's a lot of pressure not to do it. And we have a strong health team. This was their recommendation, and I absolutely support their recommendations. And we went forward with a mask mandate and agreed to disagree with the outside forces that were against it. And what we saw was a huge difference that it made. We saw our curve not just flatten, but just be bent down. And we really did get our case counts and the growth of those under control. This is back in 2020 when we didn't have the vaccine, and we were working so hard to limit the spread with the basic tools of masking and distancing and hand washing. And I'm forever grateful to our community who stepped up and heard us follow that practice and helped save lives and livelihoods, knowing that mask mandates not only have public health impacts, but also economic recovery impacts. We were able to not experience some of the same losses across the country that we saw across the country as a result of our community's adherence to these practices that are so vital in saving lives.
I think this might be a good time to mention that a few weeks ago, you had reached out and asked for some analysis to compare the experience of Lincoln with other places. And a researcher at Johns Hopkins gave you a report about that, comparing the experience with similar counties from a demographic point of view, and finding that Lincoln did quite well. I don't know if you have any of those numbers handy.
Yeah, first of all, I want to say thank you to you and to the folks at Johns Hopkins who not only assisted us with this report and understanding the findings of how we compare across the country to other counties of similar demographics, but for all of the information and advising that you have done for cities across the country and the information you've made available on the dashboard so that more people have more nuanced understandings of the situation on the ground all across the globe. We were heartened to see that so many of the actions that we've taken have resulted in some successes relative to our peer counties. We have one of the lowest mortality rates, and all along our emphasis has been on saving lives. Just to see that we were in sort of the top 10% of counties for sort of having the lowest mortality rate was really heartening. And then also, the president had set a target for vaccine uptake. And way back in July of 2021, we hit that target of 70% of our eligible population being vaccinated. By the 4th of July, we were really, really pleased with that effort. Those efforts continue, and we are sort of in the top third of the counties that we are compared to in terms of vaccination rates. And we know that that's our best tool in getting past this pandemic. So really, really grateful for the analysis that we received that helped demonstrate for everyone the success that we have when we work together to overcome this virus.
Yeah, I mean, it really is a testament to your leadership and all of the work of people in Lincoln to have results like that. And I know it hasn't been easy. If I'm not mistaken, there might have been a recall campaign against you. Can you tell us what it's been like to be a politician, in these very divisive times?
Right. It's been extraordinary, absolutely extraordinary. And I think what I have continued to focus on is serving everyone, regardless of the state of their level of anxiety, fear, concern. I think when you see those recall efforts, you really have to recognize and offer grace that in this moment where so many people feel such a lack of control over their lives, faced with uncertainty to this degree, people have different reactions. Some people are scared, afraid, they lash out, and they express themselves in really harsh ways. And then at the other end of the spectrum, we see people stepping forward and helping volunteer to deliver meals, extra meals on Meals on Wheels programs, or helping to ensure that kids who are staying at home get their free and reduced lunches delivered to them or picked up in drive-through aisles, people who do job fairs, drive-through job fairs, people who sew masks and PPE when that was scarce. There is a spectrum of reactions to the uncertainty and degree of change and disruption that we're all experiencing. And I think it's just important for all of us to recognize that and to continue to offer grace and to stay focused on doing what's right, no matter the pressures or the reactions that we're seeing out there. Just keep reminding that there will be an end. This will pass. And what I want to do is look back and be proud of the stories we'll have to tell. And I think that Lincoln is going to have a lot of really profound tales of courage, bravery, generosity, selflessness, and success to share when this is all over. And that's part of what keeps me going, ensuring we have those stories to tell.
Well, thank you. I just want to maybe close by asking you a bit about the future. I know Lincoln, like many parts of the country, is weathering the Omicron surge right now. But as that peaks and starts to go down, what are you thinking about 2022? You mentioned the American Rescue Plan funds. What are you envisioning? What's the story you're able to tell about the future for the city?
We are going to make a difference in people's lives, and we are already deploying some of those American Rescue Plan dollars to stabilize businesses. We've done grants to businesses. We are going to be launching grants for workforce development so that we are connecting people with opportunities to train and reskill or upskill in order to address workforce challenges. And we're going to be deploying significant dollars to beef up our tourism industry, to help recover and renew some of our events and attractions. And I am so excited about having the resources to do that in partnership with our business community and in partnership with the private, nonprofit sector. We have a chance to renew and recover in ways that will make us even stronger than we were before. And that is what I'm focused on for 2022.
Well, Mayor Gaylor-Baird, thank you so much for joining me on Public Health on Call. And thanks for really fighting for that environment and that future for your city.
Thank you, Josh, and thank you for all you've done.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McCusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.